Hello, everyone. I hope everybody is doing fine. Welcome to another episode of Ask Advancells. My name is Vipul Jain. I'm the founder and CEO of Advancells. And we still remain in the pandemic situation of COVID 19. Uh, although the world is starting to opening up a little bit, but it seems that the whole pandemic situation is here for the long stay. The number of cases, especially in India, continue to rise, and we are now reporting almost the highest number of cases in the world over several days. So it seems that this situation is going to continue for another few months, if not less. But at the same time, it's important to resume life. It's important to resume work. It's important to start to get some bit of normalcy back into our lives. But it is also very important to be very, very cautious, to be very, very careful of where we go, who we meet, what we do, because we all know that even just a little slip can make us get infected, and that just opens up Pandora's box. One thing that has come out very strongly in the past few months is that coronavirus has an equal effect on your mental health as it has on the physical health. And not just the mental health of the patient himself, but also for the caregivers, the family members who are caring for the patients, the doctors, the nurses, the medical staff, everybody who's involved in taking care of a patient that is infected is also suffering from a great degree of mental issues. Just because every day you are seeing somebody suffering, you are seeing somebody either deteriorating in health or at least deteriorating in spirit, and there is really not much that you can do about it. Now, if we just talk about personal caregivers, if we talk about family members who are caring for somebody who has been infected, it takes a huge mental toll on your health. I mean, I know so many people who have got some loved one who's admitted in the hospital, and they have no way of finding out how their loved one is doing. I mean, remember, traditionally in India or in many parts of the world, if somebody is in the hospital, we are all there to take care of them. Even if we can't go into the ICU, even if we can't do anything for them, we are at least outside and just trying to get some piece of information every minute. Now, that is not possible with COVID, because if the patient is inside the hospital, there is no way that an attendant can be in the hospital because it's not allowed. And so you are just sitting at home worrying. And that gets you into a different level of mental fatigue and mental depression, because there is no way you can rest, there is no way you can keep your mind at ease. And that is why what is being observed by experts around the world is that this mental health problem is starting to come up with not just with patients but also with caregivers. While there is no real tips or no real medication that can be done about this, but what I believe that everybody, all of us, along with making our bodies stronger, developing our immune system against the virus, is very, very important that we start developing our mental framework for the virus as well. Um, Experts are saying that there will be a huge amount of population, a huge percentage of population that will get infected over the next few months, and only then herd immunity, or whatever way we call it, the virus is going to go away. So it is quite possible that if you do not get infected yourself, it is quite a large chance that somebody in the family will get infected. So it is very important that we try to do those kind of mental exercises to keep our mental balance, to make ourselves mentally strong, so that when the virus actually strikes to us or to our family members, we are able to maintain our mental balance and we are able to care for them both with spirit and with body. Uh, I have personally tried things like meditation. I have personally tried listening to religious spiritual leaders. I've tried calming my mind myself when there is total havoc going on around. And trust me, something like meditation really works. Just 15 minutes of meditation every day, when you wake up or any time of the day. There are several apps available now in the phones that can help you do that. It really calms your mind, makes your mind stronger, which is really the need of the hour when you are faced with somebody who's facing these problems. So please lay emphasis on mental health as much as you do on the physical health. It's great if you are having kadas and Ayurvedic treatments. It's very important. But keeping a calm mind, meditating, focusing, keeping your mind strong is equally important. So everybody, please take care of the mind as much as you take care of the body. Till next time, if you have any questions, do reach out to us, and we will be happy to answer all of them. But till then, please stay at home, stay safe, and we will see you very soon. Thank you. Bye-bye.